In this video, I will go over the function of the complement molecules, the mechanisms through which the complement pathway can be activated, and finally discuss different forms of complement disorders. So complement pathway is part of the innate immunity, and thus there is no memory formation, and the response is non-specific. In general, complement is required for three different functions. One, inflammation, which is done by the C3A and C5A molecules. Two, formation of the membrane attack complex, which will help destroy the Neisseria species, and this is done by C5B, C6, C7, C8, and C9 molecules. And finally, it's required for the opsonization. And opsonization is the process where the C3b complement molecule or the IgG will bind to the bacteria and will mark it for phagocytosis. So there are three mechanisms through which the complement pathway can become activated. In the alternative pathway, the surface of the pathogen will interact with the C3 molecule, and then it will cause it to form the C3b, which will later on interact with factor B to form C3 convertase. In the classic pathway, the immunoglobulins of IgG and IgM will bind to the surface of the pathogens, and upon this binding, they will cause the C1 complex to become active, which will cleave C2 and C4 molecules, and their eventual product will again lead to the activation of the C3 convertase. And finally, lectin, also known as mannose binding protein, will act through the similar pathway to the classic pathway, except that the lectin or mannose binding protein will bind to the sugars that are present on the surface of the pathogens, and then it will activate a molecule that is similar to C1, and then again through the similar pathway it activates the C3 convertase. So one memory aid that you can use here is that IgG and IgM are activated by the classic pathway, so you can say that GM makes classic cars. So the classic pathway is activated by IgG and the IgM molecules. Now from here on, once the C3 convertase is activated, it will act on the C3 molecules to form C3A and C3b. And then C3b will later on lead to the activation of the C5 convertase, which will cause the conversion of C5 into C5A and C5b. So it's very important for you to know the function of each of these molecules. So let's go over that again. So C3A and C5A will induce the inflammation or the anaphylaxis reaction. So how you can memorize it is that C3A or C5A will lead to the anaphylaxis. And then we have C3b, which acts as an opsonin. It binds the bacteria. So C3b binds bacteria. And so B goes for binds bacteria. An alternative mnemonic that you can use here is C3b. It looks like a mirror image of O and P. So it's like opsonization. C3b causes opsonization. And then finally, C5b through C9 will form the membrane attack complex, which will attack the Neisseria gonorrhea and Neisseria meningitis. So just keep that in mind. If this complex is missing, then patients will be vulnerable to the Neisseria infections. Alright, now I would like to go over the disorders of the complement. So the first one is the C1 esterase inhibitor. So if the esterase inhibitor is missing, there's a deficiency of this enzyme, then there would be accumulation of C1, C2, and C4, and thus it will lead to the hereditary angioedema, where there would be edema at the mucosal surfaces. So here is an example of the angioedema, where you can see that there is edema at the mucosal surfaces of the face. And again, there are two mechanisms through which angioedema can occur. The hereditary mechanisms is due to the deficiency of the C1 esterase inhibitors, which I just discussed it with you. And then there is a drug-induced form where ACE inhibitors, such as lisinopril, will cause the accumulation of bradykinin, and then it causes the edema at the mucosal surfaces of the face. Now back to the table. The next disorder is the C3 deficiency. So C3, as you know, is required for the formation of C3b, and it's also required for the removal of the immune complexes. So if there is a deficiency of C3, then there would be recurrent pyogenic and respiratory infections because there is no C3b to opsonize the bacteria. And at the same time, the immune complexes keep circulating in the body, so there would be increased susceptibility to type 3 hypersensitivity. And if you recall, type 3 is the type of hypersensitivity that is caused by the reaction of the immune complexes with the antigens. And so there would be more circulating immune complexes that causes type 3 hypersensitivity in patients with C3 deficiency. Next, we have the C5b and C9 deficiency, and as I mentioned, this complex is required for the formation of the membrane attack complex. And thus, patients that lack membrane attack complex are susceptible to infection with the Neisseria gonorrhea and Neisseria meningitidis infections. And then finally, we have the decay accelerating factor deficiency, which will lead to the paroxysmal nocturnal hemoglobinuria, and I would like to discuss this in more detail. So paroxysmal nocturnal hemoglobinuria, also known as PNH, is an acquired disorder of the hematopoietic stem cells. And these cells are no longer able to form the glycosylphosphatidyl inositol, also known as the GPI anchoring protein. So this GPI protein is on the surface of the cells and it acts as an anchoring protein. So there are many different proteins, as many as 20 proteins that will be attached to the GPI. Among these include the CD55, which is also called decay accelerating factor, as well as the CD59, which is called the membrane attack complex inhibitor. So if the GPI is missing, then the CD55 and CD59 will also be missing. So if there is no CD59, there would be increased membrane attack complex on the surface of the cells. And then if CD55 is missing, which is also the same as the decay accelerating factors, the complement molecules would no longer be decayed, and thus there would be increased deposition of the C3b on the surface of the self molecules, and thus it will cause hemolysis. So these patients present with pancytopenia, hemoglobinuria, and thrombosis. And this thrombosis is the most common of death in patients with PNH. Now, one question that may come to your mind is that why is it called nocturnal hemoglobinuria? And the reason is that complement pathway works more efficiently in acidic environments. And during sleep, since there is more shallow breathing, there would be more acidic environment, and thus complement activation will cause more hemolysis, as a result of which in the morning these patients will have dark urine due to hemoglobinuria. Now, there are two different tests that you can use for diagnosis of the PNH. And the first one is called the Ham's test. And all you have to do is to place patient's blood cells in the acidic environment, and then you will see that the complement activation will cause the hemolysis of the blood cells in patients with PNH, versus blood cells of normal patients would not undergo hemolysis in that acidic environment. And then the second test you would use is the flow cytometry, to show that the CD55 and CD59 is missing in these patients. And if you recall, I mentioned that PNH is an acquired disorder of the hematopoietic stem cells, as a result of which the GPI anchoring protein is no longer present, and thus CD55 and CD59 would be lacking on the surface of the blood cells, and thus it causes hemolysis. Now, given that this is a disorder of the hematopoietic cells, then the treatment directed at bone marrow transplant. so that the new bone marrow transplant cells will make cells that do not lack GPI. And that concludes our discussion.